A flood watch remains in effect for the Virgin Islands until Friday evening. According to the National Weather Service, tropical weather will continue to affect the U.S. Virgin Islands and Puerto Rico Thursday and Friday. The flood watch is in effect until Friday at 8 p.m. Flash flooding and mudslides are possible. VI public schools and government officers were back open on Thursday after heavy rain and thunderstorms hit the VI Wednesday because of rain associated with the tropical wave in the eastern Caribbean. And Joey will have all the latest details in his full weather forecast coming up in just a bit. We have an update now on the more than $6 million project to upgrade VITRANS operations and maintenance facility. The Department of Public Works says the project is currently 55% completed. A DPW contractor is now installing electrical, metal, stud framing, drywall, interior perimeter wall insulation, as well as tiling, exterior wall plastering, and the drop ceiling too. So a lot of work being done right now. The new facility is part of a $6.7 million project in Anna's Hope. The building's expected to be nearly 15,000 square feet and will be the primary operating facility for VITRAN on St. Croix. It'll be comprised of 3 buildings, an operations facility, a bus washing building, and a tire storage building. The new facility will also include 4 service bays outfitted to perform complete maintenance of all the transit vehicles, as well as the administrative offices for all of VITRAN's St. Croix staff. This project is expected to be completed by this December. Liberty VI employees join Cancer Support VI to give cancer the boot. The organizations teamed up to raise money and awareness to support the fight against breast cancer in the USVI during this month of October. In addition to a $2,500 donation from the Liberty Foundation, Liberty employees are dressing in pink, as you can see, and encouraging customers to drop off their donations in pink boots, which are placed at stores in St. Thomas and St. Croix. The donations will help support Cancer VI, or Cancer Support VI. That's the organization locally to help people affected by cancer in the territory. Liberty VI's general manager says many of their employees and customers have been impacted either directly or indirectly by breast cancer. And through efforts like this, they can help make a difference. Donations can be dropped at Liberty VI stores at the Sunny Isles Shopping Center in St. Croix and Crown Bay Marina in St. Thomas until Monday, October 31st. Advisors for the FDA have delayed their discussion of a potential over-the-counter birth control pill. The advisory committee postponed its November meeting where they were expected to discuss what's called O-pill. O-pill is a non-estrogen contraceptive that women can take once a day to prevent pregnancy. Right now it must be prescribed, but the drug maker has submitted the drug for over-the-counter approval. If approved, O-pill would be the first daily birth control pill available over the counter. The FDA reportedly postponed the meeting so it could review additional information related to the potential move. COVID-19 cases remain steady in the USVI. There are currently 51 active COVID cases territory-wide, with 39 on St. Croix, 9 on St. Thomas, and 3 active cases on St. John. Meantime, more cruise lines are dropping their COVID-19 rules on Carnival cruises. You will not need proof of vaccination or testing as long as your trip is 15 nights or less. The move comes about a month after Carnival began relaxing COVID requirements. The cruise line, however, still encourages travelers to test for COVID 3 days before their trip. Princess Cruises made a similar change last week, lifting its remaining vaccine and testing requirements for a number of its voyages. A new international survey shows most people in 7 countries, including the United States, say they feel socially connected as COVID-19 precautions ease. Mandy Gaither has more on the findings and why social connections are so very important to our health.
At the height of the pandemic, with businesses shut down and people shut in, staying connected to others may not have been easy.
Human connection, it's wired into our DNA.
But a new survey by Gallup and Facebook's parent company Meta, conducted in 7 countries between April and June, shows most people feel a sense of social connection as the world eases COVID-19 precautions. In the U.S., 75% who took part said they feel very or fairly emotionally connected to others.
There's a need for us to be connected, but it does look like the pandemic did not disrupt that we are able to adapt as a species and continue that important connection.
However, at least a third of those who took part in each country said they needed support or help from someone often or sometimes in the previous month. In the U.S., 71% of those surveyed said they'd interacted in person at least once a day over the previous week, while 68% connected via text and 59% interacted over the phone.
Those who were over 65 and had a bigger social group or a bigger friend group, that tended to be associated with feeling less lonely.
As did being married and being financially stable. People who reported living comfortably felt that they had more social support than those who were finding it difficult on their current income.
At least a third of people in each country, except India, said they interacted with others on social media on a daily basis, but they were also likely to use other methods, suggesting that technology-based connection does help, but does certainly not replace any other types of interaction, according to this particular survey. So the new Powerball jackpot is now estimated to be $800 million. That increase comes after 36 drawings in a row with no grand prize winner. The next drawing is this Saturday. It's considered to be the second largest Powerball jackpot in history. If someone wins Saturday's jackpot, it'll be the 6th time the Powerball jackpot has hit this year. Tickets are $2 a play and sold in 45 states, the District of Columbia, Puerto Rico, and of course, the U.S. Virgin Islands. So if you play, good luck to you. The Marine Corps Marathon is taking place this weekend in our nation's capital. It started back in 1976 with the goal of promoting goodwill. Perhaps no runner best exemplifies that spirit than the doctor you're about to meet. Jan Crawford reports.
This weekend, Dr. Glenn Galehood will run his 45th Marine Corps Marathon. He's only missed it twice, but he's up for almost any race. So how many marathons have you run?
170 to date and counting.
How many continents?
7 continents.
He saves his medals, but his true passion is saving lives with his nonprofit Mission to Heal. It brings medical supplies and training to the most remote corners of the world.
We have done what we can to help, not just to heal the folk that we see immediately by cutting and sewing, but by teaching those skills such that it continues beyond us.
His medical missions are inspired by his runs.
The marathon is a good metaphor because it takes discipline, it takes effort, and it takes a commitment. That's what healthcare is.
Dr. Galehood is 80 years old. So how much longer do you plan to keep doing missions and running marathons?
Until the next one, and the next one, and the one after that.
Because crossing a finish line means it's time to start a new mission.
And best luck to the doctor in his race. The Marine Corps Marathon is set for October 30th. A reminder now of an event coming up this weekend. The Virgin Islands Police Department will host a Trunk or Treat Halloween event this coming weekend. VIPD, in conjunction with many partners, are hosting a Trunk or Treat Halloween event for the families of the USVI. It's a way to provide folks with a great opportunity to ensure kids have a fun and safe way to celebrate Halloween this year. The free Trunk or Treat events will take place on both St. Thomas and St. Croix on Sunday, October 30th from 2 o'clock in the afternoon until 6 p.m. The St. Thomas venue is on the Waiko dock. The St. Croix one will take place at the Kmart West parking lot.